coordinator in Coeur d'Alene, where it's a beautiful rainy day, helping keeping all those flying allergens down on the ground. I'm going to be talking about a better title for this probably would have been just Medicare prescription drug coverage. But Part A takes about a minute, so I kind of wanted to let you know that we're focusing on Part B and Part D drugs. One of the reasons I'm doing this is because it's come up quite a bit lately. Well, maybe not lately, but during open enrollment and when we were doing in-person counseling, we frequently got questions about this on the helpline and from counselors, so I'm covering it today. So our key points are to understand when Medicare Part A, B, and D cover prescription drugs, and the circumstances when drugs are covered by Part B or Part D, and to know if drugs are being billed wrong, what to do. So for Part B and Part D prescription drug coverage, how does Medicare cover prescription medications? People with Medicare may get drugs as part of their inpatient treatment during a covered stay in a hospital or a skilled nursing facility. Generally, Part A payments made to the hospital, SNF, or other inpatient setting cover all drugs provided during a covered stay. So Part A covers all drugs during a covered stay. Generally. It's always generally, isn't it? It's never always. Part B generally covers drugs that usually aren't self-administered. These drugs can be given in a doctor's office as part of their service or in a hospital outpatient department. There in the hospital, coverage is generally limited to drugs that are given by infusion or injection. In most cases, the Part B deductible applies to the drugs that Part B covers. Some outpatient prescription drugs, mainly certain oral cancer drugs, and those previously paid for by Part B are still covered.
Hey, Noreen, would you move your microphone just a little closer and speak a little bit more forcefully?
Sure.
Thank you.
Is that better?
Yeah,
How about this?
a little closer.
Okay. All right.
There you go.
All
Thank you.
righty. So Part D. Part D covers most outpatient prescription drugs. The coverage depends on plan formularies, and it cannot pay for drugs covered by Part B, as in boy. It's a key element of Part D. There's drugs that might be covered by Part B or Part D. It depends on what they're used for and how or where they're administered. These drugs include injectable drugs, vaccines, insulin, and immunosuppressants. They also include drugs that are administered or covered through DME, direct durable medical equipment like an infusion pump or a nebulizer. Injectable drugs, Part B covers injectable drugs patients usually cannot administer themselves when a doctor or someone supervised by a doctor provides the drug and administers it to them. Part D generally covers injectable drugs purchased at a pharmacy, whether a doctor administers the drug or clients can administer it themselves. Some providers can bill Part B for drugs they dispense. An example for injectable drugs is a patient needs an injectable arthritis drug that they cannot self-administer. The doctor provides the drug and administers it to the patient. The medication will be covered under Part B. Original Medicare covers these outpatient drugs at 80% of its approved amount, as long as the provider accepts Medicare assignment and the client is responsible for the 20% coinsurance.
Hey, Noreen, a couple of folks are listening on iPads or iPhones and still having a little trouble hearing you. Could you speak up just a little more?
Sure.
Okay, thank you. Everybody else, turn your speakers down.
this better? Maybe I tried to turn up my microphone, but it's pretty much turned up.
Yeah, you'll just have to talk just a little bit louder.
Okay, I'm sorry if I sound hostile.
Thank you.
Yeah, disclaimer there. So a key part of the Part B drugs is that the Part B deductible does apply to these drugs in most cases. And then they have their 80% coverage, meaning that they have the 20% coinsurance, just like they would with any other Part B charges. Um, I'm going to actually go back a little bit. Sorry about this, because I would like to expound a little bit on some of the injectable and infused drugs. Um, For injectable osteoporosis drugs like Prolia, Medicare covers injectable drugs for women with osteoporosis who meet the coverage criteria for the Medicare home health benefit and have a bone fracture that a doctor certifies was related to postmenopausal osteoporosis. So there are stringent requirements to meet this, but it does cover things like Prolia. In order to do that, the doctor must certify that the woman is unable to learn to give herself the drug by injection, and the home health nurse or aide won't be covered to provide the injection unless a family or caregivers are unable or unwilling to give the drug by injection. For antigens, Medicare helps pay for antigens if they're prepared for by a doctor and given by a properly instructed person. The person can be the patient in this case under appropriate supervision. And then there's, okay, erythropoiesis stimulating agents. Those are for people with ESRD to help treat anemia. And it does help pay for those injections that may also be self-administered or administered by a family member that are properly trained. Medicare may also cover these drugs to treat anemia for people who don't have ESRD. So those are some of the injectables specifically. For vaccines, Part B covers certain vaccines, in influenza shots, pneumonia shots, and Hep B shots for people who are at risk of contracting Hep B. Part B also covers vaccines after a patient has been exposed to a dangerous virus or disease, such as a tetanus shot after stepping on a nail, or a rabies shot after a bite from an animal. For pneumonia shots, it covers 2 shots to help prevent pneumococcal infections, and it covers a series of Hep B shots for only for people who are high or medium risk of Hep B. Part D covers most vaccines doctors recommend for patients. So Part D Part D plans must include most commercially available vaccines on their formularies. So this is where we'll see the shingle shots, and when one becomes available, the COVID-19 vaccine. Here's where I have to do the disclaimer. Remember, there are no COVID-19 vaccines available yet. Don't let anyone fool you into thinking that there is. It's a scam. So now we get to check the box for scam awareness. Okay. Part B and Part D both can also cover insulin. Part B may cover insulin that's used with an insulin pump, insulin pumps related supplies, and the insulin used with these pumps are covered as durable medical equipment if the patient meets Medicare's coverage criteria. For CGMs, continuous glucose monitors, Medicare Part B also covers continuous glucose monitors and the related supplies instead of blood sugar monitors for making diabetes treatment decisions like changes in diet and insulin dosage. Part D covers insulin and related medical supplies used to inject insulin, like syringes, gauze, and alcohol swabs for self-injected insulin. So Part D is self-injected. Part B is anything with a pump or a CGM. B or D can also cover immunosuppressive drugs. Medicare covers immunosuppressive drug therapy for people who receive an organ transplant for which Medicare made payments. If a person is entitled to Medicare only because of permanent kidney failure, the Medicare coverage will end 36 months after the transplant. Medicare won't pay for any services or items, including immunosuppressive drugs, for patients who aren't entitled to Medicare. So if they're beyond that 36 months, Medicare is not going to pay for immunosuppressive drugs if they're no longer eligible for Medicare.
Hey, Noreen,
Yeah.
I'm gonna back you up because I just noticed that Helen is interjecting about the potential COVID vaccine.
Uh-huh.
So I've unmuted Helen. Helen, can you hear
Yes.
me? Would you like to
Just a little
take that?
correction, and I just looked up the Medicare facts. When and if a vaccine becomes available, it will be covered under Part B as in boy, with no cost share. It will not go under Part D as in drug.
Okay, thank you.
Just a
Cool.
correction. Thank you.
Yep. No, thank you, Kellen. That's great. All right.
Okay, that's all for you, Helen. I'm turning you off again.
Now let's let Helen do this. That'd be awesome. Um, so for immunosuppressants, Part D covers immunosuppressants for those who did not have Medicare Part A at the time of their transplant or did not have a transplant performed in a Medicare approved facility. So they may still get coverage. People who didn't have their transplant done in a Medicare facility may still have Medicare coverage or might have coverage for their immunosuppressants that help with rejection, but it's going to be billed as Part D, not Part B. Okay. A few other things that Part B covers are blood clotting factors. If a person has hemophilia, Medicare helps pay for clotting factors. They give themselves by injection. Oral cancer drugs, oral anti-nausea drugs, IVs and feeding and tube feeding, and intravenous immune globulin given at, oh, I'm so sorry, I can't talk today. Intravenous immune globulin, IVIG provided in the home. So when a client has trouble getting medication, it's helpful to know how the medication is covered. If you're unsure, call the SHIP helpline to learn if a drug should be covered by Part A, Part B, or Part D. It's a great use for your unique ID. Verify the pharmacist or provider is submitting claims to the correct part of Medicare. I actually just had a case like this where someone was getting albuterol for a nebulizer, and they were billing it as Part D. They had a new person, they're billing it as Part D, and it was getting rejected, and it's because it was Part B for a nebulizer. If the pharmacist is having trouble billing Medicare or the Part D plan, or if the client is being denied coverage for a drug, it is possible that the medication is being billed incorrectly. Providers can reach out to the plan or Medicare for assistance submitting claims. If Part D is covered, they want to reach out to the Part D or Medicare Advantage plan provider. If Part B covered drug with a Medicare Advantage plan, they want to talk to the Medicare Advantage plan. If it's a Part B covered drug and you have original Medicare, you talk to the Medicare Administrative Coordinator, the MAC or Noridian. If payment is denied, the client has a right to appeal Medicare's or the drug plan's denial. The client's doctor must help prove the medication is medically necessary and the client meets the coverage criteria. Sheba helps clients with appeals. A lot of the resources, the information today came from the Medicare Minute from May of 2019. And that is available on the volunteer website in the resources under the Medicare Minutes. I also got information from Medicare.com, or my God, no, not Medicare.com, Medicare.gov, and a CMS partner. It's called a Information Partners. That you can find these all on CMS. It's a CMS publication 1135315-P, but it has information on Part B drugs for providers that some of this came from. Medicare Minutes are very useful. They offer chewable bites for specific Medicare topics. There's scripted material for short presentations. If you like to go out and be able to give a presentation once we're able to go out again, maybe after, many people don't like to do that, but maybe after we've all been stuck in our houses, once we're given the good to go, the all clear, then people might like to do that. They're easy explanations to share with clients or an audience, and they also allow us to have handouts. They can be used as learning materials as counselors tools. For a quick introduction or review, a quick reference, and they're user friendly. Thank you for all you do for Sheba and the Idahoans you help. Now, I'm going to share we weren't able to have our volunteer appreciation, and that's generally when we share what the work that we did in 2019 for the calendar year or the previous year. So this is what we would have done for our 2020 volunteer appreciation. We're going to talk about how many people we helped and things like that. So we're looking at what the performance measures that the federal government uses for our grant that helps fund us. And you know what, before I do this, I'm going to backtrack. I am so sorry, but do we have any questions about the Medicaid, the prescription drug coverage?
Hey, Noreen, yes, Anne has a question about it that I was going to hold off till the end, but you asked, so.
Yeah, no, let's do that first. I really meant to stop and just rolled right through because I get nervous.
Okay. Yeah. She asked, let me get back up to it. How immunosuppressants are covered for people with autoimmune diseases. Let me.
So those are covered under Part B.
Under Part B. Okay.
Mm-hmm. Let me just double check though. I had that in here in my notes. Sorry. Oh, that's immunosuppressors, sorry.
Will, and Cherie is asking, will Part D cover Hep B vaccine if not qualified for coverage under Part B?
I believe Helen can probably help with this, but I believe that is at the discretion of the plan.
Right.
I believe they don't have to include it. That's not one that they have to include on their formulary because for those that have medical indication for it, it's covered under Part B, and Part D can't cover what Part B does.
Okay. And I'll just throw another one at you while you're looking. And Helen agrees, as do I, that Part D would not have to cover Hep B. That would be discretionary on their part. Anne is asking, she's not familiar with Noridian, the Medicare administrator. Can you kind of explain their role?
God.
There are there are quite a few different contractors who make decisions, all kinds of decisions when you file appeals or grievances, or you have a problem with benefits coordination, or just file a run-of-the-mill appeal. There are private contractors who actually take those appeals and grievances and questions for Medicare and CMS, and Noridian is one of those.
And it looks like the autoimmune disorders are covered by Part B, as in the same as the like oral cancer drugs and the oral anti-nausea. They're covered the same way. Through Part B, not Part D.
Yep. And Anne's asking how you contact Noridian. It's a pretty easy, well, it's not actually, it's kind of a hard Google search, but if you Google Noridian Medicare contractor, you'll have to find the office from that handles our region, which is not the easiest thing in the world to do. Their website is pretty opaque. So you could give us a call, and I have that information in one of my files. I'm sure most of the other coordinators do as well. And Helen says that she or we can include the link in our Medicare Monday. So we'd be glad to do that as well. So that email that we're sending out on Mondays, would be glad to stick it in there as well.
Are there any other questions?
Yeah, somebody is emailing them to me. That's, let's see. Gail is asking, she says she has people who are listing Prolia and nebulizers in Part D. And then there is no 6-month frequency option, and their drug costs show up quarterly and way out of correctness.
So Prolia is a Part B drug. It's an injectable that's given by a
she's asking if we have a list of these meds we can advise people of Part B billing. I'm not aware of any comprehensive list, Gail.
No, but what I do is I had a client with Prolia, and we couldn't find it on a formulary, right? And then it came up that it was an injectable, but we just Googled it, and it met Prolia Part B or Part D, and it came up. It came up on a Google search.
And
sometimes they show up on Part D or on prescription drug lists because they're billed through pharmacies.
Mm-hmm. And Angie's saying that she does have a list, but if something goes into a nebulizer, then it's going to be covered under Part B, not Part D. Let me see. 10 days. Okay, I think that looks like everyone. Marilyn said, you mentioned Part B covers albuterol nebulizer. Oh yeah, seems to me that is, yep, same thing we just said. Okay, looks like all the questions, Noreen.
Okay. So is Marilyn's for Tom Curdy's raised hand?
Yes.
Okay. Great. Okay, so let's see what we did last year. We'll move forward. Sorry about that. I get nervous. It's probably quite apparent. So when we look at our performance for the previous year, we look at for this context, we're looking at what our grantor looks at. We're funded by the Administration for Community Living and the Idaho Department of Insurance. We have 5 performance measures. Total client contacts, public media outreach contacts, under 65 client contacts, hard to reach populations, CCFs, the client contacts that we make with low-income rural non-native English speakers, and enrollment contacts, how many people we help with enrollments. We tend to focus on total client contacts and total people reached through health fairs, enrollment events, and presentations. Focusing on these 2 basically gets us where we need to be. In 2019, for outreach, we spoke to 23,855 Idahoans at events. Those were significant contacts that our program made with Idahoans. In 2018, we recorded about 18,278. So we did about 5,500 more, which was a 31% increase. So thank you to all of you who helped us get out there and talk to people at events. For client contact forms for the program as a whole, in 2019, we reached 13,701 total Idahoans. This was one-on-one counseling, the CCFs that were entered. In 2018, we recorded 15,751 CCFs. That meant 2019 was about 2,000 less, a 13% decrease. In 2017, just to put it in perspective, 2018 was a good high year. In 2017, we recorded a 13,416. So it was really 2017 and 2019. You can see are really close. 2018, we had an increase. In Region 1, which is North Idaho, in 2019, we had a total of 4,264 client contact forms. In 2018, we had 5,025 client contact forms. That means we had 761 less last year, which was a 15% decrease in 2019 from 2018. I don't know about you guys, but it didn't feel like we were seeing 15% less people, but maybe. In Region 2, in 2019, there were a total of 5,329 client contact forms. In 2018, there were about almost 6,500. And so it was about 1,100 less CCFs last year, which was a decrease of about 17%. And then Region 3, in 2019, they had a total of 4,105 client contact forms. That was, they had 4,278 the year before, so they only had 173 less, a decrease of about 4% in Region 3. So they had a smaller decrease in Region 3. Way to go, Helen, yay! How can we continue to grow the Sheba program? Continue to report all client contact forms. If you have an appointment and you counsel someone, please record it to protect yourself and the client as well as for the program to get credit. If you call a beneficiary back on a different day of the counseling session, that's another client contact form. Each time you make contact with them on a different day, that's a contact. Report your time spent on the Sheba program, the time you spend commuting, the time you spend researching Medicare and other materials for beneficiaries, and take time talking to the Sheba staff and record the time that you spend on trainings. We really appreciate everything you do. So thank you. We missed that we couldn't see you this year for volunteer appreciation for our spring trainings, and we hope that we are going to be able to see you all again soon. Are there any other questions?
Yeah, we're going to go back to some of these, mostly the nebulizer question. There's still some questions about that. And I'm going to try to unmute Helen for this. There we go. Wasn't letting me do it earlier. There you are. Yes, thank you. Yeah, would you like to jump in on that question?
I had to do some research on this a couple years ago because I did have a gentleman that wanted it to go through his Part D. And yes, you are correct. Insulin, nebulizer insulin can come up in the Part D plan finder. The reason it comes up in the plan finder is because sometimes if someone is temporarily, say, in a skilled nursing facility and needs that nebulizer, the facility needs to be able to bill it to Part D. And the reason is because it is not their permanent residence. D will cover their permanent residence where their piece of equipment is. When someone is temporarily in a skilled nursing facility, Part B is not going to cover that because it's not their residence. So that's kind of why you will see insulin coming in on a plan finder. When I counsel someone and they start kind of saying, well, it's this liquid and they start going into a little more detail, then it kind of clicks. They're like, oh, wait a minute, that goes in my nebulizer at home. Or as a counselor, when they start talking about the solution comes in a bottle, I put it in a piece of equipment, that's usually, as a counselor, I usually say, do you have a nebulizer at home? And they say yes. And then I say, we're not even going to run that through your Part D plan because that's a Part B coverage. But hopefully that answers why it comes up in the Part D. It only comes up in Part D so that the skilled nursing facilities can bill, and they will bill the nursing facility situation, for example. Hopefully that answered that a little bit. And Angie actually provided the link for all the medications. I see she sent me an email, sent us an email that we could probably get out that explains that a little better.
Okay, awesome. We can include that in the Monday email for everyone. Because, yeah, that's ridiculously complicated and esoteric. So who's going to remember that? So it'll be nice to have on hand. Noreen, do you have anything else?
I do not.
Awesome, thank you.
Thank you. Thank you,
I
everybody.
don't see any other questions that we haven't answered. If you have any, now's the time. Or you can catch us again next time. Hey, we got through one without too many glitches, and hopefully you all could hear Noreen well, and we'll do it again next month. Thanks so much for attending, and we'll talk to you all soon.